Good morning from the Maryland Department of Health, Office of Children and Youth with Specific Healthcare Needs. Welcome to the final webinar in our Extra Support for Extraordinary People series. Today we're going to dive into the specifics of the Autism Waiver Program. Here to tell us all about it is Elisa Jones from NPH's Office of Long-Term Services and Supports. And then a little bit later, we'll hear from both Dr. Tiffany Noel Wagner and Lena Mack of the Maryland State Department of Education. So our first speaker up is going to be Elisa, and she represents the Maryland Department of Health as the state Medicaid agency within the Office of Long-Term Services and Supports. Additionally, she is the acting assistant director for the Community Integration Programs, a directorate of the Office of Long-Term Services and Supports. Elisa Jones brings her 20 years of experience with Medicaid programming to her role. In this capacity, Elisa oversees the operation and administration of 4 divisions operating multiple Medicaid fee-for-service programs, including 6 of Maryland's home and community-based service waivers, the Division of Community Long-Term Care, the Division of Developmental and Intellectual Disabilities, the Division of Legal Services, and the Division of Community Support Services. And with that, I will go ahead and let her start her presentation.
Thank you, Bailey. Good morning, afternoon. Good afternoon, everyone. I am Elisa Jones. I'm going to share my screen momentarily. I have a few slides I want to go over with you to give you a little bit of background and hopefully give you the information you came here to get. And then after that, my partners will come on and tell you even more details about the Autism Waiver program. 1 second. Okay. Again, I'm going to do a high-level overview of the home and community-based services waiver for children with autism spectrum disorder. I'm going to go over my authority to operate and administer this waiver. I'll go over the services that are offered in it, very high level, and then talk about how to become a provider if you're so interested. Okay, so the Home and Community-Based Services Waiver Program Authority stems from the Social Security Act. And in that act, in Section 1915C, the federal government gives states the authority to create opportunities for long-term service and supports delivered in the home and community. Prior to that, individuals who met the level of care required for certain programs had to do that within an institution. So this gave states the authority to provide those services in the home. Part of that authority that the federal government gives states is that one of the offices within the Maryland Department of Health or any state's health department, a certain agency has to be deemed the state Medicaid agency, which has to withhold the highest administrative authority over the waiver. Sorry about that. So my office, the Office of Long-Term Services and Supports, is the designated state Medicaid agency. And we're responsible for the administration of the waiver for children with autism spectrum disorder. And we've partnered with the Maryland State Department of Education, who you'll hear from in a few minutes. And what they have agreed to do is operate the waiver on a day-to-day basis. So when you hear about the autism waiver, most likely you'll associate it with the Maryland State Department of Education rather than the Office of Long-Term Services and Supports. So we maintain the administrative authority over the waiver, and we report to CMS annually or as needed, and definitely every 3 years where we give them performance updates. But the day-to-day operations is done at MSDE. We also have ownership over the Autism Waiver Registry Helpline, and that's really your first entry point to becoming a participant in the Autism Waiver. So the Autism Waiver Registry is a list of interested individuals, and there's a vendor who we procured to maintain the registry. So you would call the registry, get on the registry, and eventually once your name became to the top of the list, we would screen you and move you to a wait list where subsequently you'll be moved into services once the slot opens. So here's just another high-level overview. Again, this waiver has the authority of the 1915C Social Security Act. It's operated by the Maryland State Department of Education. The target group are individuals who were diagnosed with autism spectrum disorder, ages 1 through the age of 21 at the end of the year and at the end of the school year, which you turn 21. And then again, here at the bottom of the slide, you'll see the phone number if you're interested in adding someone to the waiver registry helpline. And these slides will be shared out, so you'll have this information at hand. So where you see these blue links, you'll be able to click on them once you have access to the slides. Okay, so once you get into the waiver, or sometimes even before you get on the waiver, you already have Medicaid, or interested folks will have Medicaid, because our target population are children. So most of the time they are eligible for MCHIP or some other type of community Medicaid. And with that becomes its own set of coverages outside of what you would get in the waiver. For example, if you click on this link, you'll go to the Maryland Connections website, which lists all the Medicaid services. So I'm just going to name a few. So as a child under 21, you would have access to eyeglass benefits, hearing aids, early and periodic screening, diagnosis, and treatment. Some folks may be familiar with EPSDT. And let's see, private duty nursing, school-based health-related services, and the list goes on. It's a very long list of services. But once you gain access to the waiver, you have access to these services as well. Respite care, environmental accessibility adaptations, family consultation, residential rehabilitation, intensive individual support services, therapeutic integration, and adult life planning. So it's a nice package of services that I'm here to support. If you are an agency or would like to become an agency who provides these services, the Maryland Department of Health, the Office of Long-Term Services and Supports, as well as MSDE, co-host a prospective provider workshop where interested providers can attend and hear about the provider qualifications. Each one of these services has its own set of qualifications. So you could just decide you want to do respite care, or you just want to do environmental adaptations. You don't have to apply to provide all the services. So each service has its own set of qualifications that you can target your agency to provide. Once you attend the prospective provider workshop and you have all your questions answered, we can provide technical assistance on how to go ahead and proceed with your application. All interested providers will have to use the ePrep, which is electronic provider revalidation portal, to go in and select your application that you want to submit. And then we'll work with you throughout that whole portal system to get you through it. We do have an upcoming provider interest, a prospective provider workshop coming next week, Wednesday, June 5th, 9:30 to 12:30. If you are interested, you could RSVP with Vita. She will be hosting. Here's a link for more information about that. Or you could navigate to it's the Maryland State Department of Education, Maryland Autism Waivers website, and there's a link there that you can go straight through that link and RSVP there. If you have any questions about anything I presented today, you can reach out to Veronica Baldwin, who is the waiver coordinator within my office, the Office of Long-Term Services and Supports. Or you can reach out to Lena Mack. She's the Autism Waiver Liaison with the Maryland State Department of Education, and you'll hear from Lena in just a few minutes. I know I went through that pretty fast, but let me know if you have any questions at this moment. Otherwise, you can feel free to reach out to these individuals or myself, and I'm going to turn it back over to Bailey. Thank you.
Thank you so much, Elisa, for kicking us off. I'm going to turn it over now to Dr. Wagner and Lena. And I just wanted to give you a brief background for Dr. Wagner. She is a section chief overseeing autism waiver and health-related services within the Division of Early Intervention and Special Education Services at the Maryland State Department of Education. She promotes the division's interdepartmental and interagency collaboration with key stakeholders of the state school-based Medicaid program and the home and community-based services waiver for children with autism spectrum disorder, also known as the Autism Waiver. Her team supports enhanced service delivery, compliance, and quality assurance for Medicaid providers. Prior to serving the division in this role, Dr. Wagner served as the Autism Waiver Provider Liaison for MSDE, that's the Maryland State Department of Education, and in multiple roles supporting children and their families as a provider for the Autism Waiver, a clinical specialist in residential treatment, and through project management and Medicaid billing. Her experience is enhanced by her training as a licensed clinical professional counselor, clinical supervisor, and her doctorate of education in organizational leadership. Lena joins us today as well and is a Autism Waiver Liaison within the Interagency Collaboration Branch at the Maryland State Department of Education. And prior to transitioning into this role, She was the Autism Waiver Provider Liaison. Lena possesses more than 20 years of experience in the field of autism and has been with the Autism Waiver for over 17 of those. Prior to working at MSDE, she worked at the ARC of Prince George County as an Autism Waiver Service Coordinator and Autism Waiver Program Administrator. In addition to her Autism Waiver responsibilities at the ARC, Lena conducted initial training for direct support staff in the ARC's Developmental Disabilities Administration programs and served on multiple committees, including the Human Rights and Residential Quality Support Committees. So we're delighted to have them here today, and you guys can go ahead and share your slides.
Thank you so much for inviting us here today to talk about the autism waiver. What I'll be doing is talking a little bit about the how to apply aspect of the autism waiver, and then turn it over to Tiffany to talk about our autism waiver services and a couple of autism waiver resources.
Before we start, can you guys just, we just want to make sure that everyone can see our presentation and we're sharing appropriately.
We can see it.
Okay, perfect.
Excellent. I'm attempting to advance our slide. There we go. The keyboard's not responsive, but the mouse is. So on the how to apply for autism waiver services. So we have a couple of eligibility criteria that I'll go over for you, but just to give you a little bit of background, the enrollment in autism waiver services is offered by the MSD and MDH if a child meets these three criteria. So not every child with autism will qualify for autism waiver services. All three areas under this umbrella of eligibility has to be met first. So the eligibility and application process involves going through these eligibility criteria and screening for eligibility. One of the simplest ones is technical eligibility. The child must be between the ages of 1 and 21, reside in Maryland, have a diagnosis of autism spectrum disorder, and in addition to those things, they must have an individual family service plan if they're under 3 years old, or an individualized education plan or IEP with at least 15 hours of special education and related services. In addition to that technical eligibility, children must meet what's called a level of care. And what that does is screen the amount and determine the amount of support needed for the child in three different areas. One is the basic activities of daily living, like eating and dressing and bathing. Then the other area is functional activities of daily living, like socialization, communication skills, and lastly, maladaptive behaviors. And to qualify, the child has to meet in 2 out of those 3 categories of medical eligibility. And it's a very thorough assessment that families go through. And then lastly, there is financial eligibility. And the key thing to know about financial eligibility is that when the screening is done there, what's looked at is the child's income and assets and not the family's. So per the rule, and to qualify, the person's income can't exceed more than 300% of the Social Security income. That usually equates to about $2,000. But just the most important thing for the crowd to remember here is it's child's income, and it's very rare that a child, based on their income and assets, will not qualify. Another thing that's good to know is people can't be in 2 Medicaid waivers at the same time. And that's one of our eligibility criteria. So in the case that a person's waiting to apply for the autism waiver and they're enrolled in another waiver program, such as say the family supports waiver, at that point they'd have to make a decision about whether to continue in the family supports waiver or switch over to the autism waiver. Okay. There we go. And then, so I wanted to give you a little bit of a roadmap as to what it looks like to both get yourself to the point where you're considered for an application and then actually apply. You might have heard at this point, being on this call, that there is a list of families waiting for the opportunity to apply for the autism waiver when a spot becomes available. So we've made a couple changes to this process. In the past, essentially, a parent could call and just put their child's name on that list. There was no upfront eligibility determination. So the state has put practices in place to turn, to kind of clean up the registry and turn it into more of a true wait list by looking at some eligibility criteria. And this flowcharts don't worry, it will be emailed to you afterwards. We understand the print's small, but just to give you an idea of what happens when you call that number. So you attest to a couple things up front when you call the number, including that some of the technical eligibility criteria, that your child is enrolled in school and has an IEP or IFSP with the required 15 hours of special education services, and that they are 1 through 21, and they are a resident of Maryland, and they have that autism spectrum disorder. So the phone call involves just an attestation, and then so once that's complete, the attestation is put in place, their name is added to the registry. And then what we do on our end here at MSDE is we verify what's attested to. So we'll look at the IEP and assess the hours. We'll look at the diagnosis and get a valid idea. And often the diagnosis is in the IEP. If not, we'll be reaching out to families to obtain that diagnosis. But essentially, we're verifying what you attested to on the phone about that criteria. So once established to meet the technical eligibility and verified to, you're added to a wait list. If we're not able to verify that, you wouldn't be added to the wait list and then removed from the registry at that point. So then once you're on the wait list, it's a matter of when a vacancy opens next. And then when it does, you get notified via the mail, and as does the local school system or service coordination agency that's responsible for guiding you through this process. So you get notified, they get notified, and then becomes a couple of things. It might be a couple years from the point you put your child's name on and this point. So we need to verify technical eligibility once more. And then the service coordinator in each one of our counties has a contracted, either a contracted or an employee of the local school system who acts as service coordinator. They'll work with you on this financial eligibility determination process, as well as the level of care I mentioned when we're talking about how much support your child needs in different areas. So they'll work closely with you on that. But I wanted to, because the financial eligibility determination initially does involve quite a bit of documents. It's good for you to know in advance what to expect and perhaps start gathering those documents and keeping them on hand.
Before you go into that though, Lena, I did want to point out, you mentioned that when they're invited to apply or any correspondence really comes through the mail. And sometimes there is a wait for that. So it is important for you to keep your information up to date. So if you're already on the registry or wait list, or if you're thinking about getting on the registry, like wait list, just make sure that you give accurate information. And if you move or something changes, you call them and let them know that that address changed or your phone number or something.
Yeah, that's a really good point. And also, We occasionally send voicemail blasts as well. So if you get just make sure to kind of stay on top of your voicemail and communications. We are working to enhance our communications with families who are waiting to apply. So just be aware for mailings and make sure to keep your information current and look out for voice blasts or other communications. So I'm not going to read the slide, but just to give you an awareness, and you'll see this on the PowerPoint we email out later. This is all required for the initial application. So just be aware that if you have these things in place, the application process will go faster. So just, and keep in mind again, I want, this is the most important thing to remember, because the application can look overwhelming and large, but when you look at it from the perspective of the child's income and assets, it suddenly becomes less overwhelming to look at. So keep that in mind. So you'll again receive this after the presentation. And basically, so after all this determination has been established, if the child meets medical, meets financial, and technical, then they become enrolled in the autism waiver, in addition to consenting for the autism waiver. Like I mentioned earlier, you can't be in two waivers, you have to be choosing the autism waiver. At that point, you are approved and then can develop what's called a plan of care that lists the services that your child is to receive in the autism waiver and the amount of hours that they are to receive too. And then Tiffany, I'm going to turn it over to her because she's going to talk to you about all the services that your child can receive through the autism waiver.
Yeah, and so like Lena said, in addition to the plan of care providing, listing out the services and the number of hours, it lists the providers that you want to have provide that service and the start and end date of service as well. We're going to talk about these core services that Elisa mentioned earlier, but before we do that, service coordination is not considered like kind of our core set of services. These are our core, like kind of what we call autism waiver services. But service coordination is a requirement for families. Do you want to just touch base a little bit with, how that works? And
yeah, sure. So your service coordinator at the local school system is going to be your central point of contact for really everything related to autism waiver services, starting from that initial application process through really the end of the autism waiver. It involves monthly contacts to assess. They're really there to assess that whether the services are in your child's benefit. They're required to conduct visits to your child in the school and also in the home. So they're really that core contact relating to services. And if you want to make changes to services or providers, they would be who you'd call. Mm-hmm. So you start with them, and on an ongoing basis, you maintain very close contact with them relating to your child's services. And that's embedded into our eligibility as well. The requirement to maintain contact with your service coordinator, keep them in the loop of changes as well, engage in the process of finding services, finding providers, so that once that communication is established, it's really important to maintain with your coordinator.
Yes, thank you. All right, so the first service I'm going to go over is intensive individual support services, and these are one-on-one services that use the home and the community environment as a learning experience. And really, all of our services really do that, right? Because this is a home and community-based waiver. So IISS services are based on individualized treatment plans and goals that are intended to promote the child's independence in these areas that are listed on the slide. And so that's so that the child can reside successfully at home and participate with success in the community. And if the services are provided in the community, that transportation time to and from community outings, all of that kind of stuff is included as part of that service. Participants may receive up to 40 hours a week of IASS services with a maximum of 8 hours a day. And the service can be received virtually, and legally responsible caregivers are able to provide this service to their own children. And those were both changes that were brought about during the pandemic that were made permanent afterwards. All right, the next service is Therapeutic Integration Services, or TI. These services are available as a structured program of therapeutic activities that are based on the child's need for intervention and support, also as identified in an individualized treatment plan for that child. The service can be provided after school, weekends, and on non-school days. It does have the option to be provided virtually as well. TI focuses on goal-driven expressive therapies, art, music therapy, that kind of stuff, and therapeutic recreational activities for the development of the child's communication, social skills, enhancement of self-esteem, improved peer interactions, that kind of stuff. So the program may include like socialization groups. It is available for up to 20 hours a week, and the daily session is a minimum of a half hour with a maximum of 6 hours. Transportation, transporting the child kind of to and from a TI program is included as part of that 1 to 6 hours daily. And TI is delivered at a ratio of 1 staff person for 3 participants. All right, so our next service is Intensive Therapeutic Integration, or ICI. So this is like the same service as TI, but it's available at a 1-to-1 staff to participant ratio. So it's really for those participants who need that extra support. And ICI is currently approved for 15 hours per week, although we did recently request an increase in that to align with TI services. So we should know within the next month or so if that will change. All right, now we have respite care. Respite care is short-term supervision and assistance with activities of daily living that are provided to children because of the absence of or need of relief for those persons normally providing the care. So parents, caregivers, that kind of stuff. Respite care can be provided in the child's home or place of residence, a community setting, an approved or certified youth camp. The respite care provider may also take the participant out on outings, so it could be provided in the community as well, and transportation is included as part of this service as well. And respite care is available for up to 336 hours per year. All right, the next service is family consultation. This is a face-to-face service, so that can be in person or virtually. It's consultation and training provided to the child's family. So that could be parents, it could be other relatives that live in the home, it could be siblings. So it's provided to the child's family. It's based on family-oriented, individualized treatment plan goals to assist the family to learn skills and interventions that will help them to maintain that child safely at home. An example of this might be if a participant has difficulty with communication, perhaps the family consultant would work with the family and introduce the family to kind of different communication techniques, right? Like sign language or PECS, picture exchange communication system, or something like that. And then they would teach the family how to use those communication tools to foster communication with their child. Families may receive up to 40 hours per year of family consultation services. All right, so our next service is adult life planning. Adult life planning is a family-centered approach as well. It focuses on educating and supporting the family and the participant in accessing adult services, right? It helps them to prepare for that transition to adult services, transition out of the autism waiver once they turn 21. It is outlined, their goals are outlined in an individualized treatment plan for this service as well. This service is provided face-to-face, either in person or virtually, by the adult life planner with the participant and or with a family member. And ALP services may begin when the participant turns 14 years of age. And it is available for up to 20 hours of service per year. Now, I just want to clarify, these services that run yearly, respite is 336 hours a year. If you don't use those hours in that year, they do not carry over to the next year. So I think that's a question we've been asked before. Yeah. So they're just available for that allotted time frame, just like the 40 hours of IISS a week. If you don't use them that week, you just lose them. It's not carried over to another week. All right, so environmental accessibility adaptations. These are physical adaptations to the home that are pre-authorized by the multidisciplinary team and the Maryland State Department of Education. And these adaptations are necessary to ensure the health, welfare, and safety of the child, or enable the child to function with greater independence in the home. So examples of adaptations might be alarms on windows or doors, protective padding on walls, plexiglass, outside gate or fences for the yard, that kind of stuff. At this time, a little over $2,000 is available every 3 years for EAA. Although we did just recently submit a request to increase that amount. And again, we should know within the next month or so if this is going to change. And then we have residential habilitation. And that's a community-based residential placement and therapeutic living program of treatment, intervention, training, supportive care, and oversight for those children who cannot live at home because they require a more highly supervised and supportive environment. Services are provided in approved facilities located in Maryland that are designed to provide that home-like therapeutic safe environment, which does allow, as appropriate, for the child to eventually return home to their family and or to acquire the skills and resources for group or independent living. All of our ResHab programs must provide a 24-hour therapeutic environment and coordinate with the child's other providers for clinical treatment, educational services, health, medical services, that kind of stuff. A child must receive prior approval for this out-of-home placement by the multidisciplinary team and the Maryland State Department of Education. And these services are offered at a regular or intensive level. And so intensive services include an awake overnight and at least 4 hours of one-on-one staffing. All right, so that was a quick overview of our services. In terms of resources or who to contact, we do have listed here the MSDE, the Maryland State Department of Education's website, and also the autism waiver page that this link would direct you to, offers resources related to accessing special education services and autism waiver services. And as Elisa mentioned earlier, information related to that upcoming prospective provider workshop is accessed at that link as well. And then the Maryland Department of Health's Home and Community-Based Services webpage provides information on other waiver and service programs throughout the state. We've included a few other links for additional resources as well. And note that our autism waiver registry helpline number is provided again on this slide, along with Lena's contact information, as well as an email address to reach staff who help the Maryland Department of Health maintain that autism waiver wait list. So if you have any questions about the registry or the wait list, you can reach out to that email. And I believe that was it. So we'll figure out how to stop sharing now and turn it back to you.
Thank you so much. Okay, so at this point, we can go ahead and take some questions. I'll start with things that have already been put in the chat, and then you can either chat in additional questions or you can raise your hand, and I will get to you if you stay patient for me. So let me start with some of the questions from the chat. Kelly R. asked a question about which phone number is correct as they are listed differently. Oh, I see Veronica actually answered this question. There is the correct phone number, 866-417-3480 in the chat. And we may need to make a little correction there on the slide. Are you able to apply? Carolyn asks, are you able to apply after being assessed for an LOC by a medical professional?
The level of care screening is done within the local school system. They're charged with doing that screening upon time to apply. So no outside eligibility screening is done outside of the service coordination or local school system. Sometimes, depending on the county, it might be a psychologist who is employed by the county who does the screening, or recently we made changes in order to increase capacity to allow our service coordinators who are very familiar with the tool to do so.
Great question. Yeah. And a kind of maybe another question that might come up related to this would be, so that's the level of care assessment, but in terms of the autism spectrum disorder diagnosis, that can be on the child's IEP. So that diagnosis could be listed there, and that would qualify to make them eligible to receive services for that autism diagnosis. But if that's not listed on the IEP, you may get a diagnosis from an outside source. So it does not have to be listed on the IEP.
Okay, thank you. And ND asks, did you say that financial eligibility only includes the financial items / assets in the name of the child, not in the name of parents? Is that correct?
Yes, that is correct. And a very important thing to keep in mind, just the child.
Okay, Elizabeth asks, pardon my lack of knowledge, but are these waiver services separate and apart from the ABA therapeutic services?
Yes, they are separate from applied behavior analysis. And in fact, some of our participants receive both. Since through Medicaid at least, the applied behavior analysis is not a waiver program. So children are able to receive both as long as it doesn't overlap.
Okay, I apologize. I lost my, okay, here we go. So Elizabeth also asked, can you please clarify if there is a specific age at which eligibility for these services begins?
Sure, eligibility begins at age 1 through 21. As Tiffany mentioned earlier, we do have one service that's tied to an age, and that's aside from one, that's our adult life planning, which is tied to the age 14. So participants can receive that from 14 and on. Otherwise, eligibility starts from that one and ends at 21, but not on the birthday of when the person turns 21, but rather the school, June 30th of the school year in which they turn 21.
Okay, Octavia asks, can you share what is the current average waitlist time for the autism waiver?
So that's really hard to say, right? Because as Lena mentioned earlier, we've been working really hard to turn our registry into a wait list. And while we're doing that and screening people that are on our registry, we're seeing that number go down. And also we've sent out a lot of invitations this year. So we're also seeing that number go down. So it's a little hard to say right now how long that wait list is, but it's moving in the right direction, that's for sure.
I'm gonna go ahead and answer this one. Tom Healthcare had asked, is there any way we can get a copy of the slides? They will be provided after the presentation, as well as a link to the recording, and there was some additional materials that go with it along with this presentation. Elise asks, how will we be notified that our child has been placed on the autism waiver waitlist? I joined the meeting late, sorry if you already answered this.
Yeah, no worries. So following that telephone call to the Autism Waiver Registry, that 1-866-417-3480 number, you will receive a letter in the mail verifying that your child's name has been placed on the registry. So Tiffany was mentioning earlier, it's really critical that you keep your address updated, because that is the way that you're notified, the primary way you're notified about the application status of your child and the status of their essentially wait time to apply. So you will receive the confirmation following that initial phone call if you're added to the registry.
Yeah, and if we can verify that you meet the eligibility criteria, you'll be notified that you are moving to the wait list. And if we can't verify your child's eligibility when we do that look, you do get that letter and you're provided 30 days to send information to show us that you in fact do, your child does in fact meet eligibility. So
yeah, and a perfect example of that is relating to the autism diagnosis. Say that we on our end cannot find it on your child's IEP, then per the letter, you have 30 days to supply an outside diagnosis you've obtained that shows the diagnosis of autism. So really a key thing is to look out, check your mail, and if anything looks strange, still open it. It could be from us. And to keep that address current, you can change your address by calling that same number, the 1-866-417-3480. Might as well jot it down now, keep it handy. It is that way that you can change information on your end after that initial sign up.
Okay, one more question, then we'll take Indy. Just a moment, Indy. Okay, so Carolyn asked, forgive my lack of knowledge, but how would a 1-year-old or a young child receive services if they're not yet engaged in the school system?
So we at that point would look, part of our eligibility criteria is an IFSP or individualized family service plan, and that's for so under 3 years old. So they would have an IFSP at that point to qualify.
Okay, Indy, you're welcome to unmute yourself and ask your question.
Oh, hi, thank you. Thank you for a lot of useful information. Sorry for the background noise on my end. This is my son. I registered both my son who both diagnosed with autism, and I received a letter in the mail in July 2023, and they say that this letter confirmed that your child added to the autism waiver. Can you just excuse me for a second? Mẹ ơi, mẹ con cần hộp mẹ ơi. I'm sorry. So this letter that you is to confirm that your names, your son's name is added to the Autism Waiver Service Registry on June 2023. At this time, the Maryland Department of Health cannot accept application for the autism waiver. The Waiver Service Registry is a list of people who would like to access autism waiver service in the future. By placing your name, your son's name on the waiver registry, you will be contacted when MDH is able to accept applications. And putting his name on the waiver service registry does not mean that he or she will be a waiver applicant or a waiver participant. So I have two questions. The first one, when can I expect the MDH gonna contact me about the application? And number two, because when I just make a register via the phone, I didn't provide any information at that time. So can I go ahead now and provide on the documents to save me a time in the future? Because it looked like a long process. And when I search online, they say the wait list like 8 years right now. So any advice, any recommendation for me would be helpful. Appreciate that.
Yeah, so the wait list has actually gone down from 8 years, and we talked about that a little bit earlier. As we're inviting people and as we're screening people, that wait is going down. That letter is correct, and you may not have been asked for when you called. They may not have asked you those attestation questions or anything like that, because it was a process that we just started in July of 23. So at this point, you're on that registry list. And as we screen that list, you'll be contacted. So someone from MSDE will contact you and ask for that information, those documents that you were speaking about, that your child has a diagnosis of autism and that kind of stuff. So we will reach out to you to verify all of that information, to move them to the wait list.
Do you know the timing, like a year from now, half a year from now, that I can be, because the only communication channel look like by mail, and sometimes the mail got lost in transit as well. So can you show me like the timing just for my convenience, that I just like keep my eye open or
Yeah,
like watch out,
so
because I don't want to miss that important letter.
yeah, no, I totally understand. And you can, if you have any, you may want to reach out to that autism waiver waitlist email that's on the last slide there, to talk to someone specifically. But if you have not yet been asked for information or received information that you've been moved to the wait list, you should be getting that pretty quickly, because we're working really hard to get through that whole list before the end of the fiscal year, which is June 30th. So, we're trying to get through that list. So it should be pretty quickly, but just for peace of mind, I would reach out to that email address and give us the specifics, and we can look into that for you.
Yeah, when you say the email address, do you mean the email on the slide that can be shared later?
Yes, yeah, on that last slide, the AW waitlist MSDE@maryland.gov.
Yeah, thank you.
And Lena's address and contact info, email address is on there as well. You can always reach out to her. We'll get you to the right place.
Thank you. And with that communication, the email, do you think that I can go ahead, because I know which document it requires now from the slide that you share? Can I go ahead and provide those documents in advance, just in case when my turn is up, they have the document ready to review and approve or something like that?
Yeah, that's a great question. So right now, the Maryland State Department of Education is just reviewing technical eligibility. So we just check technical eligibility before your child goes on the wait list. So that would be the autism diagnosis and the IEP or the IFSP. So I would not send anything now, because you don't want that to get overlooked, right? So you want to make sure that it's sent when asked, or if you reach out and you connect with someone, that they get it to the right place. But connect first before you send anything.
Yeah, I got you.
And then the financial stuff that Lena was talking about actually doesn't come into play until you're invited, when that slot opens up, until you're invited to actually apply. And that information goes to the autism waiver service coordinators at the local education agency. So you don't want to send any of that financial stuff to MSD.
Okay.
Okay, thank you so much. Okay, so Carolyn asked, how does one get an IFSP?
So they are developed, each county has an infants and toddlers program. So you would contact, and if you reach out to my email, I can share the number, if you tell me the county, but that's the point of contact. If you suspect that a child has a developmental delay, you contact infants and toddlers, often referred to a pediatrician, but you can call regardless, and that would be the entry point to get an evaluation, and if deemed eligible for infants and toddlers intervention, at that point, I think somebody from the infant and toddlers chimed in, would develop a IFSP.
Okay, we also had a question from Janine. Janine, do you want to go ahead and unmute yourself and you can ask your question?
Or, hi, I have a question. So my son was on the waiting list for about 6 years. He finally, I got a call back in January, February that he was offered a slot. We did the interview on February the 14th with our local coordinator with our school district. Everything I thought was in place and was submitted and everything. And that was on February 14th. I remember because it was Valentine's Day. And it is now May 30th. We have not heard anything from MDH. So I contacted our local service coordinator to find out what was going on. Did it typically take this long after you've, gone through the process? She said MDH was behind on some things. And so she gave me the number to contact MDH myself, which I did on yesterday, and was informed that they had no application on file for my child. So I contacted our service coordinator, who said she sent it on February the 14th, and she forwarded me the email that said she sent it to them on February the 14th. I was advised by MDH to apply again. I don't know what to do at this point. Can you offer any guidance on what I should do at this point? Because I don't want my son's missing out on services that he's been waiting for 6 years.
Yes, please do apply again.
No.
We want to look at your case individually. Please send me an email to follow up with your son's name.
Okay.
And I will look into it, but we don't want you to apply again.
Okay. What email is the email on one of the slides?
Yes, it's on the last slide, and it's lena.mac@maryland.gov.
Okay, gotcha. Thank you.
I don't see any more questions in the chat or any more hands raised, but I would say we have a few more minutes left. If speak now or hold your peace, or at least reach out via email after the thing if you think of something else. I'll give it just another minute so we make sure we've given you space for this, but I do thank everyone for joining us today, and thank you so much to our presenters for a great presentation and really good information. I still don't see any chat or hands at this time, so I think we can conclude today's session. And thank you so much. These will be available to rewatch. We'll send out a recording link along with the slides and additional information that they wanted to conclude with their presentations. So thank you so much. Take care.